Hi guys, this is Dr. Khan with Metro Anesthesia again. So we're going to be doing a tap block today for a patient who's having abdominal surgery. This block is great if you're having a large incision in the abdomen, but it does only cover somatic pain, so more of that superficial incisional pain, not as much the deep visceral pain. So if you want to cover both of those kind of pain types, you're going to have to do a Quadratus Lumborum block, a QL block, but this is pretty good for at least the incisional type pain, a tap block. So you're going to go on the abdomen here and identify 3 layers of the muscle: the external oblique, the internal oblique, and then the transversus abdominis. You're going to go in between the internal oblique and the transversus abdominis muscle, which is why it's called Transversus Abdominus Plane block. Have the height of the bed really comfortable for you, kind of angle them away a little bit. I also usually like to do this while the patient is intubated and paralyzed. If they're spontaneously breathing and they use their accessory muscles of respiration, it makes it a little bit more difficult to do this block. So I like to have them paralyzed while I do this block as well. So we'll put our ultrasound probe right here, and we can look on the ultrasound here. You can identify 3 pretty distinct layers of muscle. So the external oblique, the internal oblique, and then transversus abdominis. So we're going to go in this plane right here, in between the internal oblique and the transversus abdominis muscle. So I'm going to insert my needle. See my needle right there. You want to feel or see it pop through these layers. So right there, I felt that pop. I'm going to go one more layer here. Okay. So I'll bring my needle back. I like to aspirate, so let's aspirate a little bit.
Right, aspirating.
Good. Let's inject.
Injecting.
You want to see good separation, just like that, of these layers. You don't want to inject this intramuscularly, so you really want to see this good separation.
Aspirate.
We're going to aspirate every 5 cc's.
Injecting.
And this is a block where you need to use a lot of volume. You don't see the nerves individually like you would in an upper extremity block, for example. These are just nerves that kind of run in the plane, and you really need a lot of volume to capture those nerves. These are the subcostal, ilioinguinal, and iliohypogastric nerves, which correspond to about T12 to L1. So you don't want to use 10 cc's, 20 cc's of local. This is one where you're going to have to use a lot of volume, at least 30 cc's of 0.5% ropivacaine. You can also use Exparel for this block. You can also extend the life of your block by adding preservative-free clonidine or Decadron to your ropivacaine as well. Some people use 0.75% ropivacaine. Either way, just use a large amount of volume. All right, that's it. So we're going to take our needle out, and that's how you do a tap block.